So for a patient with adhesive capsulitis, they're going to typically be really limited in the range of motion of external rotation, abduction, and internal rotation. External rotation will be the most limited. For our patient in our case study, they're in the second phase, which is when things are really most stiff. So a lot of our exercises should probably be aimed around increasing their range of motion. So for this exercise here, it is an active assist range of motion for external rotation using a dowel rod. So to set up the patient, they could either be sitting or standing. Standing is probably going to be a little bit more comfortable. You can take a towel or some sort of like kind of thinner sheet and place it between their arm, and that way it's going to cue that that elbow stays close to their side during the rotation and they're not going into any abduction. You're then going to have them have their hand flat against the dowel rod that they're going to be externally rotating, and their other hand will be slowly pushing them into that motion, kind of holding for 3 to 5 seconds and then coming back in the other way. For sets and reps, you're going to want to complete anywhere from probably about 20 sets to 2 to 3 times a day. So 20 reps, 2 to 3 sets. And if they're having some issues with that, you can regress them to having more of a laying supine on a table with a weight in their hand, just pulling them into the external rotation. And if they're doing really well, they're getting that range of motion back, you can have them kind of pulling against more of a resistance, which will help strengthen those external rotators and cause them to really be able to use that more range of motion that they're getting.